Alright, so this is day 4 as a hospital pharmacist. Today we did a bunch of verification stuff. So verifying medications that were like compounded and tubing them to the floors, stuff like that. Interesting, I made something called a smog enema. Apparently this is like a mix of 4 different drugs for like severe constipation. It was glycerin, mag sulfate, mineral oil, and sodium chloride. It was interesting that we used like the injectable magnesium sulfate, 50%, and we did like 50 mils of each. And then I also saw something else called a joint cocktail, like for like joint surgeries. It was a mix of ropivacaine and clonidine and epinephrine. I guess it helps with like pain and recovery. Then I learned today that you can't inject sterile water. I never really thought of that. I guess as I thought about it, I'm like, oh, it's hypotonic. So yeah, I guess it'll make your blood cells burst. There was a question on compatibility with piptazo or Zosyn and doxycycline IV. Those are not compatible. So most incompatibilities with like IV stuff is gonna depend on like the pH of the solution. This is a basic level concept that we learned in pharmacy school. So like drugs that are more basic are gonna be in a more acidic like solution so that it's ionized and in solution. So when you have like acidic drugs, those are going to be in more basic solutions. So if you're running a drug that is like in a basic solution, one in an acidic solution, they're going to come out of like solution, they're going to precipitate. And then of course we also have like chelating agents binding with like ions. So something to keep in mind is EDTA. It's a preservative, but it also chelates with like calcium and stuff. Some other little things flagged today, like duplicate orders seems to happen like kind of often, not like super often, but it seems to be one of the most common like interventions. Like say someone is on like a brand name medication like Zyprexa and that's their home med and they're like continued on Zyprexa generic in the hospital. Like there's duplicate orders sometimes. I'm not exactly sure how that happens because I feel like the provider like is supposed to look at the meds before they order it. I don't know. It's my 4th day. Every day we have like a huddle and we all talk about like just medications that are on back order, just like workflow things and great catches at the end of it, which is really nice. So one catch I think was like with Botox. Apparently like it's a charge on dispense drug, I guess, and they're pulling it and it charges when they pull it, and I guess like the nurses like lost it or something, and then like they had to pull it again or something was happening where the patient was getting like Uber charged for like a lot of it. I don't know what was happening there, but I guess Botox is expensive, so the pharmacist had to go back and fix like the billing on it. We also did a TPN order today. It was a custom TPN order. Pharmacists work with the dietitians in the hospital to make sure that we're meeting like nutrition needs, and we're looking at labs and making sure like a lab or electrolyte's not too high or too low, and we're adjusting it. So this patient was transitioned onto like cyclic feeds. I guess they were maybe having like recurring like infections, so it might be better to have that like off period. Remember, bugs are gonna grow if you give them something tasty. So yeah, bloodstream infections. Woo. Another cool thing that I learned is that we actually use the BCG vaccine like in people's like bladder if they have bladder cancer. I was like, what? I never thought about that. I guess it might produce like an immune response, and I guess your body, I don't know, gobbles up its own like cancer cells. I don't know. I haven't had time to like super look into it. There's still a bunch of like procedural stuff that I'm going through, trying to figure out like how to verify everything and how everything connects. But yeah, I don't ever want to go back to community pharmacy, like ever. Oh, I don't know. I might still pick up like a shift a month. It's just, oh my God, like I feel like, I keep saying this, but I feel like a refugee. Like, I am a community pharmacy refugee. And the pharmacists there keep talking about how, like, oh yeah, it's so rare that we have community pharmacists, and we don't usually get community pharmacists in the hospital. And I'm just like, I'm like nervous. Don't tell me that. Like, don't tell me that. I'm like, ugh. I'm still like anxious. It's still too good to be true. Like, I feel like I have all these pharmacists around me that are like older and they've been there forever and they're really smart, and like I feel like they like took me under their wing. I'm like, I'm learning so much. But yeah, I really like the team. They're all like super chill and sweet, and like there's like never any problems. I'm like, thank God. I feel like there's a lot of problems all the time in community pharmacy. So your girl's finally getting some rest.